and welcome to Catalyst. Today we'll be discussing the link between obesity and the risk of developing osteoarthritis. Osteoarthritis is a debilitating condition that commonly affects older people in society. Recently, the increasing prevalence of obesity has been found to be associated with an increasing number of people developing osteoarthritis. Tonight, we will be meeting with Mr. McCarthy, a 32-year-old father of two who works as an IT consultant. With a high BMI, Mr. McCarthy is at a greater risk of developing osteoarthritis. Mr. McCarthy, thanks for joining us. Could you please tell us a little bit about what your GP explained to you about your situation?
Well, basically, my doctor told me that my weight had become a problem for my health, both in the immediate and long-term future. He also said that things like heart disease and diabetes are immediate effects, but he went on to say that I'm at serious risk of developing osteoarthritis down the line.
Earlier, we spoke with Mr. McCarthy's GP, Dr. DeCuna, who explained what some of the risk factors for developing osteoarthritis are. So Dr. DeCuna, what are the general factors underlying osteoarthritis?
Well, there are many factors which may contribute to the development of osteoarthritis in a particular individual. These include injuries to joints which poorly heal, repetitive strain injuries which place extra stresses on certain joints over time, as well as factors that we cannot avoid, such as natural degeneration of joints through aging. Additionally, genetics, nutrition, and more recently obesity have also been found to play an important role in the onset and progression of osteoarthritis.
So in the case of Mr. McCarthy, why were you concerned that he was at a higher risk for developing osteoarthritis?
Well, Mr. McCarthy is your typical overweight patient, and recently there has been a lot of discussion in the scientific and medical community suggesting that being overweight is a significant contributing factor to osteoarthritis, particularly in the primary weight-bearing joints such as the hip and knee joints. In fact, there have been a number of studies within the last decade which state that individuals with a body mass index of over 30 have a much higher risk of developing osteoarthritis. So with a BMI of 35, I was concerned that Mr. McCarthy was putting himself at a high risk of osteoarthritis, as well as a number of other health conditions. So together with Mr. McCarthy and I discussed how we could make some changes to his lifestyle that would lower his risk and improve his overall health.
To find out a little bit more about how obesity may lead to the development of osteoarthritis, I spoke with leading orthopedic surgeon Professor Kumar. Professor Kumar, could you please tell us why an increase in weight is a risk factor for osteoarthritis?
Well, when Mr. McCarthy walks, the increased stress on his joints caused by obesity is the main factor in his risk for suffering joint space and cartilage loss, and hence developing progressive osteoarthritis. This is because the peak compressive load during gait, for instance, on the knee joint, tends to be 2 to 4 times body weight. The increased transarticular load causes greater wear and tear on hyaline cartilage and surrounding structures, especially around weight-bearing joints, causing bony thickening and overgrowths below the cartilage about joint margins. Stress may thus decrease joint resilience, slow the capacity of chondrocytes to maintain cartilaginous matrix, and induce matrix breakdown as chondrocytes elaborate molecules known as cytokine mediators that stimulate the release of chondrocyte lytic enzyme. This has important macroscopic and clinical consequences. For example, in a study I was recently involved in with some of my peers, we found subjects experienced a 4-fold decrease in joint loads for each unit of body weight lost, while each unit rise in BMI was associated with a minimum 4-fold increase in their risk of progressive osteoarthritis. Indeed, consensus amongst obesity specialists is that at least 10% weight loss is necessary in order to reduce other risk factors associated with being overweight or obese, such as cardiovascular disease and type 2 diabetes mellitus.
Mr. McCarthy, could you tell us how you felt after talking to your GP?
Well, yeah, after seeing my GP I was quite alarmed because I've got 2 young kids and I want to be able to run around with them. I decided it was time to do something and make a lifestyle change, make many changes actually, before anything serious happens. It was a big wake-up call.
I'd then spoke with dietitian Dr. Kashish and exercise physiologist Miss Mills about how someone such as Mr. McCarthy can reduce their weight and lower the risk of developing osteoarthritis. Dr. Kashish and Miss Mills, thank you for coming on the show.
Thanks, Julia.
Dr. Kashish, what sort of dietary changes should someone like Mr. McCarthy be making to reduce their weight and the risk of developing osteoarthritis?
Well, firstly, Mr. McCarthy should reflect on his current dietary habits and the types of foods he's eating. In order to reduce his weight to avoid the consequences of obesity and heart disease and osteoarthritis, he should introduce moderation into his diet. This involves having healthier and smaller portions of food throughout the day. Of course, this also needs to be accompanied with the introduction of an exercise regime, because as we all know, losing weight involves more than just changing your dietary habits.
Could you also explain what food you would recommend Mr. McCarthy change in his diet?
Sure. In order to help Mr. McCarthy lose weight, we will encourage him to avoid processed foods as they contain elements such as sugar, corn syrup and oils that contribute to an increase in weight. Some examples of these are processed meats, canned foods, as well as packaged high-calorie snack foods such as potato chips and chocolate. Mr. McCarthy must also eliminate all fast foods and drinks that are high in fat and sugar. These include your things like McDonald's, KFC, soft drink and processed juice. He should also try to limit, if not avoid, his consumption of alcohol, as has been proven in many studies to contain a high calorie content and slow metabolism significantly. Mr. McCarthy should shift his diet to one containing high amounts of fibre and protein. Fibre can be attained by eating flax seeds, kidney beans, fruit and green leafy vegetables such as broccoli. Fibre is useful in weight loss as our bodies are incapable of digesting it. Therefore, it remains in our stomach for long periods of time, suppressing appetite. Mr. McCarthy must also drink plenty of water as this helps to reduce toxins, increase metabolism of fats, as well as suppress appetite. Protein works in a similar fashion to fibre as an appetite suppressant. Healthy foods that are high in protein include lean red meats, fish such as low-fat tuna and salmon, lentils and legumes. So provided Mr. McCarthy can adhere to these simple principles, he'll be well on the way to losing some weight and feeling much healthier.
Miss Mills, from your point of view, what do you think would be the most effective way to reduce Mr. McCarthy's risk of developing osteoarthritis?
Well, Julia, I guess there is no surefire way of avoiding osteoarthritis, but it has been shown that the most effective way to reduce the risk of developing symptoms, if you're overweight or obese, is just to lose a bit of weight. Osteoarthritis most commonly affects the joints of the hands, the lower back, the hips and the knees, the latter of which are all weight-bearing joints. Having even a little excess body weight increases the strain and the pressure on these joints.
So what exercises would you recommend for Mr. McCarthy?
Well, obviously weight loss is a combination of both diet and exercise. But for a healthy adult, as a bare minimum, it's recommended that you get at least 150 minutes of physical activity per week. That is, any sort of activity that gets you slightly short of breath or raises a bit of a light sweat. In addition to that, it's also recommended that you do just a few sessions of fairly heavy intensity aerobic activity. Any exercise that really gets your heart going for a solid 30 minutes. If you can manage it, try and throw in a couple of resistance training exercise sessions that involve weight-bearing exercises that help you build up your muscle strength and get a bit of muscle tone. It doesn't take much weight loss for benefits to appear. Studies have shown that overweight or obese people who lost even 5 kilos decreased their risk of osteoarthritis by 50%. So obviously exercise is an important component of losing weight.
Over the following months, Mr. McCarthy has been following the advice of his GP and has been exercising for at least 30 minutes daily and has made big changes to his diet.
Keep going, man.
Doing good.
Well done.
Whew. Since changing my diet and exercise, I've lost a lot of weight, feeling a lot better, and I'm looking forward to playing with my kids more.